Welcome to Chapter 9 of Medical Law and Ethics, Public Health Responsibilities of Physicians and Other Healthcare Practitioners. Over this chapter, we will cover the following learning outcomes. We'll define and determine the purpose of collecting vital statistics and identify reporting procedures, summarize the purpose of public health statutes, cite examples of reportable diseases and injuries and explain how they're reported, and discuss federal drug regulations, including the Controlled Substances Act. Here's a list of key terms that we will cover in this chapter. We will begin with vital statistics. Vital statistics are numbers collected for the population of live births, deaths, fetal deaths, marriages, divorces, induced terminations of pregnancy or abortions, and any change in civil status that occurs during an individual's lifetime. Healthcare practitioners help in gathering this information and filling out forms for filing with the appropriate state and federal agencies. Vital statistic information is used by educational institutions, governmental agencies, research scientists, private industry, and other organizations and individuals. They are useful for tracking population composition and growth, measuring educational standards, monitoring communicable diseases, and other community and environmental health problems. Healthcare personnel play an important role in collecting and recording this health data. Therefore, it's important to know the correct methods and procedures for reporting this public data. Both birth and death certificates are permanent legal records, and a copy of a birth certificate is required to obtain most government documents such as a passport, driver's license, voter registration card, or social security card. Some guidelines for completing the forms are to either type or legibly print all entries, leave no entries blank, avoid corrections and erasures, where requested, provide signatures, file only originals with the state registrar, verify the spelling of names, avoid abbreviations, and refer any problems to the appropriate state officials. All live births must be reported to the state registrar. In some states, separate birth and death certificates must be filed for stillborns, whereas others, there is a special form for stillbirths that include both the birth and death information. Hospitals usually file birth certificates for babies born to mothers that have been admitted as patients, and the attending physician must verify all medical information. For births that happen outside of the hospital, the person in attendance or midwife is responsible for filing the birth certificate. After a person is pronounced dead, the attending physician must complete the medical portion of the certificate of death. This usually contains the following information: the disease, injury, and complication that caused the death, and how long the patient was treated for this disease, injury, or complication before death, the date and time of death, place of death, and if the patient or deceased was female, the presence or absence of pregnancy, and lastly, whether or not an autopsy was performed. An autopsy is a postmortem examination to determine the cause of death or to obtain physiological evidence, as in the case of a suspicious death. Deaths that are subject to an autopsy are those that are possibly due to criminal causes, ones that were unattended by a physician within a specified length of time before death, due to causes undetermined by the physician, or violent or otherwise suspicious deaths. If any of these situations exist, either a medical examiner or coroner must sign the death certificate instead of a physician. If the death occurs under suspicious circumstances, permission from family or next of kin is not needed for the autopsy to be performed. However, if it is a normal death with no suspicious circumstances, consent from the next of kin or a legally responsible party must be obtained before an autopsy will be performed. Just for clarification, a coroner is a public official who investigates and holds inquests over those who die from unknown or violent causes. They may or may not be a physician, depending on particular state law, whereas a medical examiner is a physician who investigates suspicious or unexplained deaths. Forensic medicine. This is a division of medicine that incorporates law and medicine and involves medical issues or medical proof at trials having to do with malpractice, crimes, and accidents. This is more like your CSI TV shows. Forensic scientists investigate crime scenes and present medical proof at trials and hearings. They are specialists in forensic medicine and study subjects such as pharmacology, toxicology, blood splatter interpretation, DNA analytical techniques, and expert testimony procedures. They work for the police, medical examiners, universities, and other facilities and government agencies. They are trained to determine cause of death or injury and to help identify a criminal, victim, or others involved in these crimes. The state's power to initiate public health statutes is inferred from the 10th Amendment to the U.S. Constitution. The amendment states, "The powers not delegated to the United States by the Constitution, nor prohibited by it to the states, are reserved to the states, respectively, or to the people." In other words, states retain police powers and all other powers not expressly granted to the federal government. A practice referred to as federalism, the sharing of power among national, state, and local governments. Public health statutes help guarantee the health and well-being of citizens. Some different provisions of public health statutes include guarding against unsanitary conditions in public facilities, inspecting establishments where food and drinks are processed and sold. So these would be your health inspector coming in to restaurants, to different public locations, making sure everything is clean, everything is how it should be in order for your food to come out in a healthy and safe manner. They're going to exterminate pests and vermin that can cause disease. They'll check water quality and make sure that it's within a certain limits. They'll set up measures for control of certain diseases, and requiring physicians, school nurses, and other healthcare workers to file certain reports for the protection of citizens. States are able to enforce these statutes by requiring investigations to be conducted in infectious disease outbreaks, making childhood vaccinations a condition for school entry, banning the distribution of free cigarette samples around schools or in areas where children congregate, instituting smoking bans or restrictions, involuntarily detaining or quarantining individuals who have certain infectious diseases, and seizing or destroying property to contain the threat of toxic substances. An example of an involuntary or forced quarantine is in your book in one of the case studies, where a gentleman with TB started treatment multiple times and would discontinue treatment before going through the whole series. The state was able to file and say that he was more likely to create drug-resistant bacteria, and he had an infectious disease that was dangerous to society. So they were able to involuntarily detain him in a tuberculosis treatment center for 12 months to continue through the full treatment plan. prior to them being able to detain him, he had 2 family members and 4 other people that also tested positive for tuberculosis. These were people that he was in contact with on multiple occasions. So the present and real danger of some of these diseases is there, and that is why the states have the power to quarantine individuals. Reportable diseases and injuries. Reportable diseases are determined by each state, but they usually contain things such as anthrax, botulism, brucellosis, cholera, diphtheria, which is whooping cough, hepatitis, HIV, different types of the flu, Legionnaire's disease, leprosy, Lyme's disease, meningococcal disease, mumps and measles or rubella, pertussis, the plague, rabies, both small animals and humans, SARS, which is what our current COVID situation is based in, smallpox, tuberculosis, and typhoid fever. These diseases are reported in order to track trends or outbreaks and be able to contain them before they get larger. STDs, or sexually transmitted diseases, or now known as STIs, sexually transmitted infections, must be reported when they are diagnosed. These are anything that are transmitted through sexual contact. There's an extensive list of STIs, but the ones that are reported usually include gonorrhea, syphilis, chlamydia, scabies, pubic lice, crabs, and a few others. Public health practitioners use reported cases to find and treat others who may have been infected through sexual contact with the named individual. All 50 states, the District of Columbia, and some cities now have laws that require individuals infected with HIV or their healthcare providers to notify past and present sexual or needle-sharing partners. This is, again, to make sure that we can get ahead of the curve and get treatment to these people and testing to these people before it becomes a bigger problem. Reporting requirements for communicable diseases are more stringent for patients who are employed in restaurants, cafeterias, daycare centers, schools, healthcare facilities, and other places where they have exposure to the public and contagion can be way more rampant. Vaccines are usually started in small children or infants, sometimes even starting at the hospital when the child is born. When children reach school age, most states ask for proof of this vaccination to make sure they can enter the school system. And because a small percentage of vaccinated children have adverse effects from the vaccine, parents or guardians must be informed of these risks and then must sign consent forms allowing the doctor to administer the vaccine. The National Vaccine Injury Act of 1986 created the National Vaccine Injury Compensation Program, or VICP. The reason for creating this system was to relieve the vaccine manufacturers and the providers from having to pay for lawsuits due to vaccine injuries. And they did this to prevent, it's a small group of companies that make vaccines, so they didn't want to have monetary punishments to these companies to create a shortage of vaccines. The VICP program, or Vaccine Injury Compensation Program, is a no-fault system designed to allow compensation to either an individual or family who's been injured by childhood vaccines. The program serves as an alternative to suing the manufacturers and providers. but it doesn't take away their legal right to sue manufacturers or providers. The U.S. Court of Federal Claims decides who gets compensation. You would have to prove the problems were caused by the vaccine. And sometimes people will have a reaction to the vaccine that's not listed on the table or on the usual reaction list. In such a case, the person or family would have to prove that that vaccine caused the condition or the injury. So the Smallpox Emergency Personnel Protection Act of 2003, or the SEPA Act, established a no-fault program to provide benefits or compensation to individuals, healthcare workers, emergency responders who were injured as a result of the administration of smallpox countermeasures, including that vaccine. This program provides benefit to anyone injured as a result of accidental smallpox inoculation. So vaccination documentation. Whenever a vaccine is administered, this list of items needs to be documented. First, the date the vaccine was administered, the vaccine manufacturer, the vaccine lot number, and then the name, address, and title of the healthcare provider who administered the vaccine. While vaccinations are required for school admission, all school immunization laws grant exemptions to children for medical reasons. These could be things like an HIV infection, organ transplants, allergies to eggs that are used while preparing vaccines. They also grant some religious exemptions for people whose religious beliefs prohibit immunizations. Some of the problems with vaccine exemptions is those children that aren't vaccinated or vaccinations aren't up to date are more vulnerable to contracting a really serious infectious disease. These can lead to lifelong impairments, sometimes death. They also create an environment where even vaccinated children are more likely to catch these diseases because people around them have an active case of it. These could create public health emergencies. The vaccine adverse events reporting system should be notified anytime an adverse event from a vaccination occurs. The adverse event can be reported by anyone, but healthcare professionals need to report certain events. These adverse effects are usually things like anaphylactic shock, encephalitis, seizures, illness, disability, or injury. They're usually more serious adverse events. It's not things like a rash or a fever. And any contraindicating event listed in the manufacturer's package inserts. Injuries that must be reported by healthcare are things like assault, rape, domestic violence, which includes child abuse, spousal abuse, or elder abuse. Child Abuse Prevention and Treatment Act that was passed in 1974 requires doctors to report cases of child abuse or suspected child abuse. Most states also require reporting elder abuse or suspected elder abuse as well. Elder abuse has become more prevalent in recent years, and they fall under the same categories as children where they have nowhere else to turn. They don't have access to help. So doctors, care providers are required to report these incidents. Spousal abuse or domestic abuse can be more difficult because if the spouse or domestic partner does not want to admit to the abuse, it becomes very hard to report it if they adamantly deny it. Some different signs of abuse that medical personnel need to be aware of and look for are unexplained fractures, Repeated injuries, especially ones that have unusual shapes or in unusual places. Sometimes they're shaped like certain objects, belt buckles, etc. Burns with unusual shapes. They could be done by cigarettes or an iron, something like that. Friction marks caused by ropes or cords. Bite marks. Signs of malnutrition or dehydration. These are things like extreme weight loss, dry skin, and red-rimmed or sunken eyes. You could have possible sexual abuse if you have torn or bloody underwear, pain or bruising in the genital area, or unexplained venereal diseases or genital infections. On top of physical signs of abuse, you can also look for behavioral signs of abuse. These could be things like illogical or unreasonable explanations for the injuries, a story that just doesn't make sense, frequently changing physicians or missing medical appointments, attempts to hide their injuries with heavy makeup or sunglasses, frequent anxiety, depression, or loss of emotional control, and changes in appetite, problems at school or on the job. Drug regulations. The federal government has jurisdiction over the manufacture and distribution of drugs in the United States. The FDA, or Food and Drug Administration, an agency within the Department of Health and Human Services, tests and approves drugs before releasing them for public use. They also oversee drug quality and standardization. The FDA also oversees the recall of drugs and/or food items. A recall is a voluntary action taken by a company to remove a defective product from the market. Drug recalls are sometimes voluntary based on the company's own initiative and also by FDA request. The FDA's role in a recall is to oversee the company's strategy, assess the adequacy of the recall, and classify the recall. Both federal and state governments regulate the sale and use of certain drugs. At the federal level, the Drug Enforcement Administration, or the DEA, regulates the sale and use of drugs by authority granted in the Comprehensive Drug Abuse Prevention and Control Act of 1970. This is more often referred to as the Controlled Substances Act. The Controlled Substances Act is a federal law giving authority to the Drug Enforcement Administration to regulate the sale and use of drugs. Regulations put into force by the Controlled Substances Act require doctors and other healthcare practitioners who purchase, prescribe, dispense, or administer, or in any way handle controlled drugs to follow certain procedures. First, they must register with the DEA through a division office. If the physician practices in more than one state, he needs a DEA number for each state. The physician must notify appropriate state authorities whenever he or she moves from a registered location. They need to keep records concerning the administration or dispensing of controlled drugs on file for 2 years. The records have to include the patient's full name, address, the reason for the use of the drug, the date of the order, the name of the drug, dosage form and quantity of the drug, and whether it was administered or dispensed. They need to note on the patient's chart when controlled substances are administered or dispensed, make written inventory of drug supplies every 2 years and keep such records for an additional 2 years, and keep drugs in a locked cabinet or safe and report any thefts immediately to the DEA or local police. The Controlled Substances Act provides 5 categories or schedules of drugs based on their potential for abuse. If they have no potential for abuse, they are not considered a controlled substance. So Schedule 1 currently has no accepted medical use. These are things like heroin, LSD, marijuana, ecstasy, methaqualone. Schedule II drugs have high potential for abuse. Some of these lead to severe psychological or physical dependence. They're also considered dangerous. Examples of Schedule II drugs are combination products with less than 15 milligrams of hydrocodone, Vicodin, cocaine, methamphetamine, methadone, Dilaudid, Demerol, OxyContin, fentanyl, Adderall, and Ritalin. Schedule III drugs have a moderate to low potential for physical or psychological dependence. They have more than those of Schedule IV, but less than those of Schedule I and II. These are things like products containing less than 90 milligrams of codeine. Schedule IV drugs have a low potential for abuse and a low risk of dependence. Schedule IV drugs would be Xanax, Zoma, Valium, Ativan, Talwin, Ambien, and Tramadol. And then you have your Schedule V drugs. Schedule Vs have a lower potential for abuse than Schedule IV drugs and consist of preparations containing limited quantities of certain narcotics. Schedule V drugs are used for antidiarrheal, antitussive, or analgesic purposes. So cough syrups, painkillers, and antidiarrheals. Some examples of this would be cough syrups with less than 200 milligrams of codeine per 100 milliliters, like Robitussin, Lyrica, things like that. Schedule II drugs require a properly written, manually signed prescription. No refills are permitted on these prescriptions, and a new prescription must be written each time. All other scheduled drugs, Schedules III through V, may be prescribed on written or oral orders, and refills are generally permitted with certain limitations. In all 50 states, all Schedule II through V prescriptions may be sent electronically. However, some physicians will only provide manually written prescriptions for Schedule II drugs. Medical and recreational marijuana. As of April 2019, 34 states have laws allowing medical marijuana, and 11 states and the District of Columbia have laws allowing recreational marijuana. Marijuana is a Schedule I controlled substance. Definitions of what medical marijuana are differ by state, and so do the regulations. While it's often stated that a physician's prescription is necessary, it is actually a physician's recommendation that is necessary. Under federal law, physicians cannot write a prescription for marijuana. However, the federal government has not prosecuted physicians for writing recommendations. Marijuana is big business. Colorado and Washington were the first two states to legalize recreational marijuana. Colorado first authorized medical marijuana in 2000. Then in 2012, voters approved recreational marijuana, and sales began in January of 2014. As of 2018, sales of marijuana in the state reached $1.1 billion. Washington state sales were $1.3 billion, and the state collected $319 million in taxes on those sales. Physicians and other healthcare staff must be familiar with the laws that govern such threats such as communicable diseases, physical and mental abuse, and drug abuse, because they play a vital role in maintaining healthy and safe communities. Thank you for joining me for Medical Law and Ethics, Chapter 9, Public Health Responsibilities of Physicians and Other Healthcare Practitioners.